We're here in Enugu today for the baseline for WeCare Nigeria Initiative. This is a flagship initiative starting with UNTH, University of Nigeria Teaching Hospital. This is a hospital that's well respected. It's a federal-owned hospital in Ituku, Enugu. So, as we head to UNTH today, our goal is to gather baseline, meet with the top executives at the hospital, meet with the WeCare Nigeria Change ambassadors, and gather data from patients on patient satisfaction, gather more data from the medical staff on satisfaction. It's actually a survey. So I look forward to getting a tour of the hospital. I look forward to working with the team. Most of our team is in the US, and a number of them are not able to come during this baseline visit. How are you? Hello.
This must be your I met you before. I remember that. Good to see you. Good to see you. You are getting there yourself. Not ever. You're very young doctor. That's the way my dad is. Charles. You're famous in London.
All of you for being so gracious, for partnering with us. You could have treated us as, just foreigners that are trying to invade your space, but you didn't. You actually, especially the CMT, Dr. Kingsley, you embraced this without knowing what will happen, right? And so far, so good. And so whatever baseline we're getting, the strike affects it.
Of course.
You know what I'm saying?
We understand.
Well, yeah, we're definitely going to highlight that.
Maybe when the strike is called off, we'll do another one.
Absolutely.
And so, yeah.
Okay, so he's here, yeah. So he probably wants to see, show him, Tulia, show him impressive.
Thank you.
Yes, it's definitely impressive.
I know what leadership is about.
Yeah, it's not easy. We're in the middle of nowhere, in the forest.
Yeah, that's exactly.
The forest.
Do we walk?
Oh yeah, sure. It's not
Okay.
a little distance though.
No. I'm wearing tennis shoes.
Yes. Okay. These are my classmates.
Okay. Nana.
It's a pleasure.
Nice to meet you.
Welcome.
Nice to meet you.
She's
Thank
doing
you so
great
much.
things here.
Hello.
Actually, we're partner with us.
Thank
This is the CEO of the UNTH Foundation.
Oh.
Yes, Professor Tesi.
You attended the meeting? Oh, nice. Thank you. Nice meeting you. Thank you
This
so much.
Former CPRO, Chief PRO of the hospital.
Oh,
yes.
okay.
He's retired now.
Okay.
The guy was so good, we kept him on contract, and he's the secretary to the foundation.
Wow. Oh,
yes,
wonderful. I know.
Yeah,
I saw it online.
I will talk to him first, then I will reach out to you to see if there's anything we can do.
Absolutely.
Collaboration things.
Absolutely. Yeah, it's all about helping, making like real help, not the one that.
Not just talk. Yeah. Then I was going to come to Las Vegas just to meet me and be sure that the passion there on a very serious note.
When God puts something in your heart, you can't. There's nothing you can do about it.
With the ticket, everything. And then when I was going to come, she cancelled.
I was in the meeting. I heard you talk. I said I was going to say that instead of my baby presumption was just meeting you. And I will talk with him and then see how I can get the access to talk
go
to
through
you.
me. Yeah.
Our goal is to first go in today to understand from the people that carry the burden, understand how we can really support. What are the root causes of the issues in these hospitals? What prevents nurses and doctors from bringing out their heart and enforcing compassionate care and ensuring that these patients are well taken care of.
No, this is not how we do it.
So you see that concrete slab, you see that exercise.
That's right.
So it's not how we do it. We
yes.
don't use to
we don't
have
use
this
to
in
do
there.
this. Exactly.
Yeah, so no, but essentially the point that these things are dynamic.
Dynamic.
Okay, once the situation changes,
You have to change with it.
Because you are too old. You can't adjust to the current situation.
I can well
as
relate.
long as it doesn't harm anybody.
That's it.
Anybody.
And as long as it aids efficiency.
Yes,
It's all about
that's the
efficiency.
word.
It's all
It's
about
all about
efficiency.
efficiency, yes.
But that's where the training comes in.
Exactly.
Sometimes people kind of need to hear this, kind of like what we did on the call.
Yeah.
You know, the people that have ears will hear, and
Yeah.
you know, some people were actually saying it that
Yeah.
man, you were speaking to me.
Exactly.
So because
Yes.
it's things they know already, but
But
just
it's how to change it.
yeah,
No, but that's okay. Like I said, we just have it open. So once people deploy,
right,
you take your guide.
Yeah.
right,
That's all is important.
yeah.
Yeah, because we need to see how to do it differently, and for the sake of what? The patients.
Yeah.
For the sake of
That's
the
the most
patients.
important thing
Yeah.
about it. The efficiency is for the patient, the
Yeah.
compassion is for the patient. Like I said, one is at the youth service center, that's somewhere at Obinago. Am I right? Yes, Obinago. Yes, it's at Obinago. Then another one just went for repairs.
Oh, you have only 3 ambulances?
We have 2.5. But the problem was they had
I think I
ambulance-
read about it,
Yes,
yeah.
they had ambulance vehicles stationed all over this place. Now, for people to use them was something else. And remember, it's not the same situations you find in UK, the same situations you find in the US, where you call an ambulance, it comes. Why it doesn't apply like that is because you work with insurance. Here is out of pocket.
Oh, but you do have insurance though, but it doesn't work.
No, the
know.
insurance is
Yeah.
for basic.
Is that what it is?
Yeah,
No,
that's
it doesn't
what it
cover
is.
emergency services.
No, if anybody at the end of the day, you'll have to pay for it. You get it? So that's the main drawback with that. So the point is for us to try to push to be sure that you have some degree of coverage.
Yeah.
Even here, as we speak, we don't have free, service for patients who come in immediately. So we're trying to establish an emergency medical fund, whereby we domicile maybe 5 million or something. So you can come in, you get like all these trauma cases.
What's the 5 million gonna do for like how
It's
many
going to
people?
do a lot of things for so many people who don't have money. It does. So the point is that the person is to start somewhere.
I know.
You get it? So when you get to that point,
Yeah.
so the people will now be able to have access without the hindrance of having to pay money.
Yes.
You get it?
Yes.
Now, even if they are rich people,
Yeah.
the first is to get the service.
Yes.
Then at the end of the day, on discharge,
Yeah.
you can ask, pay your money.
Yes.
Some may not be able to pay.
Right.
Those who will be able to pay will pay and will recycle the money.
Right.
That's what we are planning. So the patients will come, once there's a security man around here, will notify the nurse, the triage nurse. The triage nurse will now tell the porter that there is somebody here, okay? And they will come and move the patient in here. So we don't do anything here particularly. The delay time, like you are trying to say, is only dependent on accessibility of the porter. Yes, if the porter is there free, because here we work a situation where the porter is a cleaner.
Okay.
That's when we station a porter at the triage area, which you are going to see shortly. So they may take the porter, oh, come
and
there's
do
something
something
over there.
else. Yeah.
So by the time the patient is arriving, he will not be there to wheel in the patient. So
That's a
you
big
have
problem.
some time. She works in the holding area for medical emergency.
Okay.
Okay? That is the problem.
Okay.
Yeah.
So does it mean that these monitors can be serviced here in Nigeria?
They tried to service them, but it wasn't possible.
Okay.
The Servo Eye, the one, the monitor, where is it again?
Yeah, over there.
Where is the Servo Eye? Where is the Servo Eye?
Can I use my season?
Is it there?
Servicing on the same.
Or the one they are trying to do that? Okay, it's okay.
Yeah, servicing.
Okay,
Yes.
all right. So it's okay.
It's a pleasure to meet everyone. My name is Dr. Nena Ihekoro-Madu. Yeah, so some of you that joined the call might remember me. And this is Chibogo Binwa. She's the program director. Remember her? And then we have a couple of the team members, the WeCare Nigeria volunteers here with us. So we really appreciate you. Those of you that filled out the forms, thank you. No, please sit down.
And you know, when you have a team, you know, and you have some in the team who are more committed than others, it could also be a challenge. You know, and that happens even not just in the hospital environment. It happens in places where, you know, places that are committed to change, you know, to caring, to helping, to transforming. So it's important that we're having this conversation. We're coming again in January, but for the fact that you came together and even waited for us to finish our tour is also evident that, you know, you're so committed to this initiative, and we look forward to working together.
Once we achieve that, we'll move on to the next topic. But it doesn't take my eyes off of training. That's what makes you authorities in your discipline. So you become an authority in your discipline. So we talked about this already. The R, the numbers, the pay, how much you're paid, and then efficiency. So, but the C, that's where we're going now. And everyone needs to know the ultimate goal. We're not just telling you to be compassionate, we're not just saying it, it's that, but it's everything else too. But you need help while doing it. So, the videos we have, the survey will be shared, and we're going to get you help. And it's not in my hands, it's in God's hands. Okay, as you know. But our job is to, the Quantus Medical Foundation team, our job is to really take this to a very high level and show them, I mean, they need help, you need help. So this is our first hospital, but there are many other hospitals already calling us to come and do this. But my focus is here. Number one. One of the things that we found from the survey is that a lot of you have been in this working in this hospital a very long time, and you're still here, which tells me that there's love here. The leadership, for one, is doing an incredible job based on the response. I'm saying based on the responses we're getting, but they can only do so much. So I think it's time that we seek help in many different ways. Remuneration, we talked about it, like pay. Technology, the efficiency, making sure that we bring you the right supplies, equipment. Yes. It's a lot of things. Different departments need help, but we're starting with the C, the compassionate care, because if all of you are thinking Japa, if everybody is thinking Japa, then who is going to be here? Right? This place will crumble. So I don't want to talk about Japa. I just want to focus on the people here today. And while you're here today, let us do the best we can to get you the help you need and get you rewarded appropriately. But we just ask that you work from the heart. One shift at a time, one day at a time. Because based on what I'm seeing, it's hard. it's hard. There's no AC. The conditions are difficult. I get it. It's hard for us to understand it when we're out there. But that's why I wanted to come myself. Hello, my name is Dr. Nenna Ihekorom Madu. I'm the founder and CEO of Quantus Medical Foundation. I'm a physician by training, and my background is in biopharmaceutical clinical research. I've spent about 25 years working with different corporations, biotech and pharmaceuticals. I currently work as a consultant for different biotech companies in the US. I'm based in Dallas, Texas. I've got 2 kids. My son is Michael. He's 24 on Christmas Day. My daughter is Nikki, and she's 22. So I'm a proud mom. I've spent most of my adult life in the United States of America, but recently God put it in my heart to give back in a way that I never imagined. Help hospitals, help the medical staff, help support patients. Patient care in Nigeria has really taken a big drop over the years, and currently the healthcare system in Nigeria is broken, to put it mildly. So we've put together Quantus Medical Foundation, specifically this initiative, to support compassionate care and bring back dignity in Nigerian hospitals. So on day 1 of the Change Management Leadership Forum, which was yesterday, this was a forum that included UNTH WeCare Change Ambassadors, who are heads of departments and leaders of the hospital. It also included the executive leadership team of the hospital, led by the Chief Medical Director, Professor Obinna Onodugo. It was an incredibly awesome 2-day experience where we first rolled out compassionate care and what it really means, how to show compassion. We rolled this out to over 100 of them. By doing so, we made it clear that the time to change the culture here in UNTH is now, because this is an esteemed hospital. We're very, very happy to be here. We hope that our meetings today, our discussions will be fruitful. Tomorrow, we're also meeting. It's going to be for training, BLS training, compassionate care training, porter training. So for those of you that do not need to be here tomorrow, just be aware that we've got all that going. So in addition to everything we'll discuss today, be aware that tomorrow a lot of training will be going on. And then after that, we plan on returning in the summer to continue this process. Thank you.
They will do some trainings, and these are some of the things that will just true or false? About being a the one who got and then you will get them one of them. There's taking anything what on the on and here. What is so?
That patient in front of you, can you imagine how they'll look at you, or their relative will look at you if they're about to give this something? Thank you. I'll take care of you. Right there, they're going to carry that news to the next person.
In the summit that a porter doubles as a cleaner as well.
Yes.
So we need to figure out how to make that demarcation so that we don't overburden the porter, and so that when the porter is supposed to be doing his or her job, in the emergency, He's not somewhere cleaning the ward. So it also depends on you. We're highlighting these issues because they need to be addressed.
We realized that for us to achieve that change, we need people that have been around longer than us. A change icon is like a retired professor, a public servant, like the Commissioner of Health, the Governor of the state, who has learned about this initiative and are interested in championing it, speaking up, because we need a change in the healthcare system in Nigeria. I'm sure you will all agree. So, you're about to hear from Professor Ifeoma Okoye.
Hello, I'm Emeritus Professor Ifeoma Okoye, and I'm currently the Director of the University of Nigeria Center of Excellence for Clinical Trials. Today I'll be speaking to us as someone who has spent many years, indeed 44 years going to 45 years, working within Nigeria's healthcare system, training healthcare professionals, caring for patients, and building structures that strengthen how care is delivered to our patients. So healthcare is not only about medicine and technology, it is about people. People being both the patients we serve and the professionals who show up every day to do this difficult work. And I can tell you, it's not an easy work. I want to speak directly to doctors, as I'm one of you, and I'm talking to other healthcare professionals who are important parts of the healthcare delivery system across Enugu State and across Nigeria. Many of us are tired. Many of us feel stretched. Many of us feel undervalued. And some of the young ones, or a lot of the young ones, including some of the middle-aged ones, are uncertain about the future. These feelings, they are real, and they deserve to be acknowledged. At the same time, I would like us to know that we must remember why healthcare matters. Every patient who comes to us is vulnerable. We are vulnerable because we can be on the other side. I've been a patient, I've had loved ones very close to me as patients. And it is not only our competence that patients need, but also our humanity. Compassionate care is not an extra, please. It is an essential part of good clinical practice. I remember when we were being trained, we were taught the importance of bedside manner in the treatment and outcomes of our patients. It shows in how we speak, how we explain, how we listen, even what our eyes are saying, and how we protect the dignity of those who have been entrusted to us to care for. Excellence in healthcare, it requires teamwork, multidisciplinary effort. No single profession, no single department or institution can do this alone. We must work together. Clinicians, researchers, administrators, government, and partners to create the enabling environment where healthcare professionals are supported, are respected, and are fairly compensated. That is why I strongly support the WeCare Nigeria Initiative. It is good news. It is a win-win project. WeCare Nigeria is focused on restoring compassionate care, dignity, and professionalism in our hospitals. You know, one of the doctrines of Nsukka says restoring the dignity of man. That's exactly what WeCare is here to do, whilst also addressing the deeper cultural and systemic issues that have contributed to the burnout and the loss of skilled professionals from our country. The hemorrhage is immense, no doubt about it. If you're working in the hospital space, you will see whole departments completely devoid of the experts they have been building over the years because they've all jabbered. So we need to pay attention to this issue. Through initiatives like WeCare Nigeria, we can begin to rebuild trust between the patients and the providers and among healthcare professionals themselves. We can create systems where people feel proud to work, valued for their contributions, and confident that they can build meaningful careers here at home. This is our country. This is where we are meant to serve. I am pleased to lend my voice and support to this WeCare movement. Compassion, empathy must remain at the center of everything we do in healthcare. Because when we care well for our patients and for one another, we strengthen the future of healthcare in Nigeria. Together, we can build a healthcare system that honors dignity, supports its professionals, and delivers excellence in care. Thank you very much.
It was an incredibly awesome 2-day experience where we rolled out compassionate care. We rolled this out to over 100 of them.
Heavenly Father, we thank you for this beautiful day as we've gathered here to discuss and to learn about the things we can do to become more compassionate to our patients. We ask you to be here with us. May we all open our hearts to learn what it is that we need to learn to advance the care that we deliver to our patients. All these and many more we ask through Christ our Lord. Amen. In the name of the Father,
and of the Son, and of the Holy Spirit. So what you're about to watch is a short video that gives you an idea of how we started. We're going to then listen to one of the UNTH professors speak to you about the importance of compassionate care. And then after that, we're going to get into the actual compassionate care training.
We had a training on compassionate care. Basically, to say that infrastructure does not see the patient. When patients come to see us, it is not about infrastructure. It is about the care that we give as human beings. And that was exactly the message that we received yesterday. That the UNTH can have all the equipment, have all the infrastructure. If we don't have the right culture, our patients will still not get well treated. Many times our patients are forced to come to UNTH because they don't have a choice. I don't think that is good. We should graduate to this situation where patients really fall over themselves to come to UNTH because they know that when they come here, they will receive compassionate care. And at such times we can say, this is UNTH, where you get the best, where you get the best attention, where you get the best treatment, where you get the best medical care from the medical team. And truly, We have a great team. We have one of the best array of medical personnel in this country. We have a huge number of consultants trained in different fields, very versatile. Many of them trained abroad. We have a huge array of nurses specialized at different cadre. We do. So why is it that patients come here and still come out disgruntled, unhappy, and tell people, don't go to UNTH except you're dying? Of course, we know it's reducing, but it's still there. It's still there. So something needs to be done about it. And graciously, as we are all worried about it, a team landed all the way from America, led by my own classmates, one of our very best, who has held numerous big positions. This lady you're sitting here, you think she's simple. You look at her, she's just looking there, wearing her cap, sitting down and talking quietly. This woman is a dynamite. I'm just telling you, she has been up there, seen it all, done it all. I'm just telling you, she basically wants to give back. We're not paying her a dime to do this. She's instead giving her all, giving her money, giving her time, giving her energy, sacrificing, leaving her family, selling, should I say that one? Let me just leave it. But she has really made a lot of sacrifice to be here. For one purpose. For one purpose. For us to acquire that new culture of compassionate care. Despite all your knowledge, how compassionate are you as a physician, as a nurse? That is part of why we are here. That's the main reason we're here. Today we are continuing from what we stopped yesterday. I know there will be some trainings on basic life support and all that. But know that all that is geared towards knowledge. Let your humanness still come in as you see the patients.
Stabilize first, and then talk about records, payment, delivery. And I understand, again, the culture here is, for the most part, you don't say anything to the doctor, but they wouldn't like it. Or why wouldn't you? What are they going to do? Hire you? No. So, tell the truth. Let them know that the patient deserves to know. We are not going to be the ones saying it, but it's the doctor. But urge the doctors, because they need to know the truth. As long as it's the truth, and it's already, they are sure, and it truly is the prognosis. If they are not sure, communicate what they know. That's the standard, and it should be so in UNTH. We used Utopian Healthcare, which is our training partner, to roll out the BLS training. We rolled out compassionate care training, and finally, we rolled out the porter training.
So that's why everyone needs this skill, even a gate man, a cook, a nurse, a doctor, everyone, and we are in the right place. So at the end of today's training, you will not just learn a skill, you will be a lifesaver. So we are going to be using playing both videos, and then we'll be talking according to the American Heart Association. This is guideline. Yeah. So we'll use both videos. We'll watch, we'll discuss, and we'll practice.
If the victim is a child, then you need to press the child button to
take it to the childhood. Does that make sense?
We provided practical skills to the doctors and nurses, and then we empowered the porters with not just training on how to do the job as a porter, but how to keep the patients safe while transporting them.
We've heard about porter, now call me patient relative. After this training, I know it will never happen.
Amen.
We finally empowered them with walkie-talkies because we believe deeply that communication is key. But even better is effective communication. So with the walkie-talkies given to the porters, the nurses, and the patient liaisons that will support the accident and emergency units, we feel that we empowered the frontline teams with not just the skill sets, but also the ability to communicate freely and effectively. This is because in emergency situations, speed matters, compassion matters, respect matters, and dignity. I pray that together, as we establish this culture change in UNTH and we make it sustainable, I pray that UNTH is empowered enough to then become the pilot for the rest of the country.
WeCare.
WeCare Nigeria.
WeCare Nigeria project.
WeCare movement.
WeCare Initiative program.
I lend my own voice.
For the time to act
is now.